Hi, my name is Ginny Bumgardner. I work at the Ohio State University Medical Center, and I'm one of the transplant surgeons in the Department of Surgery. Early on in my education, I was always very interested in science, and then in higher levels of education, that connection between science and medicine was a really special one for me. I found it very exciting, and I think that's how I ended up in medicine. Transplant is just an amazing area. I think when I first started medical school, I encountered the field of immunology, which is the study of the immune system. And that corresponded beautifully when I started my third-year medical student rotation, where I took care of transplant patients, where their immune system is suppressed by the medications that we give them so that they can retain their organs. The combination of the science behind immunology and the impact of transplantation upon patients who have end-stage organ failure was just a really beautiful fit for me and what I wanted to do. It's really important people understand what the expectations are of the transplant surgery that they're going to receive, expectations of how they will feel afterwards, what they're expected to do, and potential complications. It's a very complex area, and I think it's not easy to grasp. And for that reason, we have multiple touch points in our program where we explain the process of transplantation and what will be required throughout the period of time, from the time they're on the wait list to the time they come in for the transplant. End-stage organ failure does not discriminate in terms of who it affects. And so in my practice, I get to really interact with just a variety of people, which I find very interesting. And I think the impact upon their lives are just very gratifying to me, because after surgery, I follow them in the clinic, and we get to talk about how they've progressed not only from the surgery, but in their lives as well. And I find that very gratifying.